The intraoral part of the salivary gland examination requires that we palpate the salivary glands both from the outside as well as from the inside. Open, please. And what we will do is we'll palpate the parotid gland and look for clear flow through the parotid duct upon palpation. For the submandibular gland, we'll ask the patient to relax as we, by digitally palpate the gland. I will place my fifth digit in the recesses of the patient's mouth as I am placing counter pressure on the patient's gland from the outside. Once again, I will gently squeeze on the gland and note consistency, as well as note as the quantity and quality of the saliva as it expresses from the submandibular duct. If you'd hold your head down just a tiny bit, I think we might be able to see that. And we'll look for expression of flow through the submandibular ducts for both quantity as well as quality. The intraoral examination of the muscles of mastication include the medial pterygoid muscle, the lateral pterygoid muscle, as well as the masseter origin and the temporalis insertion areas. For the medial pterygoid, we will palpate the patient's muscle on the anterior and medial portion of their ramus, right back in where my finger is right now. And we'll ask the patient if that hurts them. For the lateral pterygoid muscle, this is a very, very difficult muscle to palpate. In fact, would you hand me that Q-tip, please? I will often ask the patient to move their jaw to me and then be able to palpate the lateral pterygoid muscle with the Q-tip. May be a little difficult for the audience to see, but we will ask the patient if that is tender. The masseter origin is another important muscle intraorally to palpate. I'll remind you that it's just inferior to the zygomatic arch or the cheekbone. So I'll ask the patient to close, then I'll palpate just under the cheekbone area where the masseter muscle originates. Lastly, I will palpate the temporalis's insertion on the coronoid process. I'll ask the patient to open, and then I will follow the anterior portion of the ramus all the way up to the coronoid process, and I will press on this muscle. Typically, this muscle will be tender if, in fact, the patient is clenching and or grinding their teeth at night. And that completes the muscle of mastication intraoral examination. The intraoral examination includes a dental and periodontal examination, which will be covered in a different module. For this module, we will look at the oral mucosa of the patient's oral cavity. First thing, once again, is we'd like to inspect the lips for any changes in color or consistency. Once again, sometimes we'll note if a patient has been exposed to the sun, we'll notice changes on the lip, particularly at the vermilion border to the skin. We'll also want to note the angles of the patient's lips for any significant changes. Open, please. Intraorally, we begin a process of inspecting the entire tissue that the patient has in their oral cavity. We'd like to look at the labial mucosas, both on the upper as well as the lower. As we're doing that, we're also inspecting the patient's gingival tissue for any signs of lesion, inflammation, and/or infection. Next portion of the examination is the patient's buccal mucosa. Open and please turn toward me. And let me just adjust that light. And we'll inspect the patient's buccal mucosa. We'll look for any changes, once again, in color, consistency, or texture of the tissue. It is not uncommon to see a linea alba, as was described in the previous module. Turn a little away from me, please. And we will also want to inspect the patient's opposite buccal mucosa. And as we stretch out the tissue, we can get a very good appreciation for any changes that we may see. In this case, we are starting to see a slight linea alba, or a white line, suggesting perhaps a little bit of cheek biting in our patient. Close, turn a little bit back toward me. Close again. One other area intraorally that we like to inspect is the vestibule. Now, although we do this in all four quadrants, I will just point it out in the lower right quadrant of the patient's mouth. We want to make sure that there are no changes in color, texture, or any lesions that may appear in this area here. Okay, you can close. Next, we'll move to the patient's tongue. And I'll ask the patient to please stick out their tongue, and I'll inspect the dorsum of the patient's tongue. That's the top portion of the tongue. I'll note any changes, and I'll gently palpate the tongue to see if there are any lesions or masses within the tongue. Next, I will ask the patient to stick out their tongue again, and this time I will wrap it a little bit in gauze so that I'm able to extend the tongue even further. This is a very important examination as an oral cancer screening, as many of the oral cancers occur in the lateral border of the tongue, which once again is this section of the tongue. It is very, very important, turn to me, to inspect deep into the floor of the mouth. So we'll actually displace the tongue to the opposite side as we look deep into the vestibule of the mouth. Once again, it is in this posterior floor of the mouth region where oral cancer may begin. We will do this for both sides of the tongue, once again, noting any change in color, texture, or any lesion thereof. Open, please. Another common area for oral cancer is known as the retromolar trigone area, which is the area just beyond the last molar on the lower as it moves to the upper tissue into the soft palate. We'll want to note any change in color in this retromolar trigone area. Finally, I'll ask the patient to extend their neck slightly so that we're able to view the patient's hard palate and inspect once again for for changes in color, texture, any lesion, or any mass that is noted. There are minor salivary glands in this area, which could be a source of a benign or malignant salivary gland tumor. And so we'd like to inspect is the soft palate for any lesions, changes in color or texture, as well as for asymmetry of the tonsils. Also mindful of cranial nerves number 9 and 10 for symmetric movement of the palate. That is, that it's moving up on both sides equally. Would you say ah, please?